I'm Don Johnson, and welcome to the show. Today we are going to focus on Gammaknife, stereotactic radiosurgery, a treatment for patients with brain tumors. The Gammaknife was developed in the 1950s by Swedish professor Lars Leksell and was a major advance in brain surgery. Doctors could now operate on a brain tumor without having to surgically cut open patients with a knife. Today, the Gammaknife radiosurgery has been used for over 350,000 patients for a variety of indications. The Gammaknife is a unique procedure designed to control tumors within the brain, both benign and malignant. It also can be used to treat other conditions such as trigeminal neuralgia, which causes severe facial pain.
The big plus for me was that I didn't have to stay overnight at the hospital. I lead a fairly active life, so for me, the Gammaknife procedure was definitely the way to go.
I had trigeminal neuralgia, which was very painful and debilitating. My doctors offered all kinds of treatments, but there were just too many risks. Finally, I decided on the Gammaknife radiosurgery procedure. I liked the fact that with Gammaknife, there were no surgical incisions, and I didn't have to undergo anesthesia. It was definitely the most appealing treatment to me.
As a Gammaknife patient, there are three main phases that you undergo: preparation, radiosurgery, and follow-up. Preparation begins when you meet with the Gammaknife team. Doctors or nurses from the team will talk with you about the procedure and whether it is good to have a MRI or CT scan. Routine blood and urine tests are also taken at this time. This is the best time to ask questions. Note that pregnant women cannot have the Gammaknife surgery. After you return home, the next step is to take a shower the night before the procedure. You cannot eat or drink after midnight or the morning of the procedure. However, you should take your usual medication with a few sips of water. Your doctor may prescribe additional medication if you're at risk of seizures. The day of the procedure, you should not wear any jewelry or makeup. The second phase, radiosurgery, begins when you arrive at the Gammaknife suite. You will change into your comfortable, loose clothes or ones provided by the hospital and use the lavatory to empty your bladder. You will remove your glasses, contact lenses, dentures, and any other items that may interfere with the treatment. Any valuable items or articles must be given to a family member, companion, or hospital staff. Your family or companion will be taken to a nearby waiting room where they can relax during your treatment. You will receive an intravenous line, also called an IV, so that fluids and medications can be given to you during your treatment. A blood pressure cuff will be attached to your arm to monitor your blood pressure. You will also be wearing a finger monitor that will measure your breathing and heart rate. Next, you will be fitted for the Gammaknife machine. Dr. David Huang, a board-certified specialist in radiation oncology and a member of the Cancer Care Consultants Medical Associates, explains the Gammaknife procedure.
Well, welcome here to the Gammaknife suite. This is where we house the Leksell Gammaknife Model C unit. This is our stereotactic radiosurgery machine. This here is a stereotactic head frame, and this is what we use to localize the patient's head to the appropriate position.
And exactly how is this frame attached, Dr. Wong?
Well, this is actually attached first of all to the patient's head, and we use these 4 pins to attach directly onto the patient's scalp. Subsequently, this will be attached to the machine like such. For the delivery of the radiation treatment with Gammaknife.
Is that painful for the patient?
Well, placing the pins onto the scalp may be a little bit uncomfortable, so what we usually use is some numbing medicine on the scalp at those points where the 4 pins attach, as well as underneath the scalp we use a little bit of injectable numbing medicine.
It sounds so daunting when you first think about it, but it's basically just a head frame that they put around your head, and they screw it into the 4 little spots in your head, and it's just a little bit of pressure. It kind of felt like I had a hat on that was just a little bit too tight. That was it.
It was a breeze. I mean, the actual surgery, I didn't feel a thing. It was quick and effective.
Subsequently, after the patient has the head frame put on, we actually bring them to the imaging center to take the pictures that we need to plan the treatment.
Exactly what type of imagings are we referring to here?
Well, most patients will get MRI scans if we can do them. Some will actually get CT scans, and occasionally we'll need to do special cerebral angiograms for this. After these imaging studies are done, the patient is actually brought here back to the Gammaknife suite. where they're allowed to relax for a little bit while we do the planning of the treatment.
Next, your radiosurgery will begin. The frame attached to your head will be connected to the Gammaknife helmet that will hold your head still and in position. When the procedure begins, the Gammaknife team will have to exit the room, but you are not alone.
Can you hear me now?
Yes, I can.
From the control booth, the doctors can talk to you and see you at all times. The procedure begins when the Gammaknife moves you into position. It is important to keep your hands down when the table moves. The gamma rays are silent and invisible, and best of all, you won't feel them.
They attach the frame to the bed, which is a very odd feeling to have someone complete control of your head, but there was no pain whatsoever. And basically, you lay there and they say, just stay still for 5-10 minutes and it's done.
The total time you spend in the Gammaknife depends on your diagnosis. It can be anywhere from 20 minutes to several hours. Often, a patient is required to take several different positions under the rays of the Gammaknife. When you're finished, the Gammaknife will move the bed back into position. The head frame will then be removed. Sometimes bleeding may occur where the pins were attached, so Band-Aids will be placed. Your head will also be wrapped with gauze. When you are able to eat and drink, a nurse will remove your IV. After that, you can just relax. Most patients can go home the same day. The final phase is follow-up. This phase begins after your procedure when you return home. The Gammaknife doesn't work right away, sometimes taking months or even years for the completion of the effects. That's why the third phase, follow-up, is very important. Some side effects you may feel after you return home may include: your scalp may tingle or feel numb. Your eyes may be swollen 1 to 2 days. You may experience headaches. Some patients may experience nausea. You will follow up with your doctors in a few weeks. Further follow-ups are determined by the condition that you had treated. Follow-up MRI studies will be ordered by your doctor. As time passes, your Gammaknife procedure will continue to take effect.
It was easy, and really it didn't feel like anything.
The Gammaknife team was great. This is a fantastic alternative to going under the knife. I highly recommend it.
The pain that I had before the procedure, it's completely gone, and now I can continue my life without hesitation.
To sum up the Gammaknife procedure as a patient, you will go through 3 main phases. In the first phase, preparation, you will meet with your doctors and other professionals to review your case and give you a chance to ask questions. You will also take tests and learn how to prepare. The second phase is the entire day of the radiosurgery. After arriving at the Gammaknife suite, an IV line, blood pressure cuff, and finger monitor will be attached. A head frame will be fitted, and you'll wear it for the rest of the procedure. Next, you have an MRI or a CAT scan. Patients who have a AVM in the brain will have an angiogram. While you relax, the Gammaknife team plans your radiosurgery treatment. The effects of the Gammaknife take time, which is why the third phase, follow-up, is very important. This may include brain imaging studies such as MRI, CT, or angiograms. Gammaknife radiosurgery is not for everyone, but it can be preferable to open skull surgery for many patients.
I think honestly the most challenging part was just not knowing what to expect. I did get to watch one of these videos when I had my procedure, and it really alleviated a lot of the pressure, and it helped me quite a bit to realize that it was just the unknown that I was afraid of.
If you have any additional questions regarding Gammaknife or the procedure or how it works, you may contact your physician. I'm Don Johnson, and thank you for joining us on Cancer Therapy Update.